Welcome to the launch of the Power of Advocacy, a new impact report from the Advanced Family Planning Initiative. My name is Sarah Whitmarsh. I'm the Senior Communication Advisor for Advanced Family Planning. Based at the Bill and Melinda Gates Institute for Population and Reproductive Health at the Johns Hopkins Bloomberg School of Public Health. I'm joined today by my co-host, Tanushree Manji. Tanushree, would you like to introduce yourself?
Thank you, Sarah. Hello, everyone. I'm Tanushree Manji, working as Officer Advocacy and Communication at Maristows, Bangladesh. Thank you.
A few logistics notes before we get started. Please use the chat box if you have any technical issues. And be sure to go ahead and select your language of choice, either French or English, using the tabs below. During the presentation, type any questions you have in the Q&A box. We will get to them at the end of the session. And finally, we will share the webinar recording and slides after the launch. Our agenda today will include an opening segment of high-level remarks by family planning champions. Then Tanushree and I will provide highlights from the Power of Advocacy report. Next, you will hear 3 impact stories from partners and collaborators of Advanced Family Planning. And finally, we will close out with a Q&A session. Now on to you, Tanushree.
Thanks again, Sarah. We would like to begin this occasion, this celebration of advocacy, by hearing from high-level champions from academia and government. Now, I would like to invite Dr. Ellen McKenzie, Dean of the Bloomberg School of Public Health, to discuss why public health advocacy is essential to creating sustainable and impactful change. Dean McKenzie.
Thank you for joining the Advanced Family Planning Initiative and the Bill and Melinda Gates Institute for Population and Reproductive Health as it launches its new impact report, The Power of Advocacy. The Johns Hopkins Bloomberg School of Public Health is the proud home of Advanced Family Planning, or AFP. In the 13 years since its launch at the first International Conference on Family Planning in Uganda, AFP has grown tremendously. From a small core group of partners in Indonesia, Tanzania, and Uganda, it has become one of the largest, longest-running investments in family planning advocacy, a global initiative that has touched over 30 countries with policy changes that potentially benefit 197 million women of reproductive age. With the initiative ending next year, it is high time to celebrate the remarkable work of AFP's partners and collaborators, and to recognize the steadfast support of the Bill and Melinda Gates Foundation, the David and Lucille Packard Foundation, and the William and Flora Hewlett Foundation. Because at its essence, advanced family planning is a partnership of dynamic, committed organizations, governments, donors, and individual champions, including many of you who join us this morning. Thank you for your tireless efforts. You helped shape a policy and funding foundation that supports people's ability to plan when and whether to have a child by using quality, voluntary, life-saving contraception. While you will hear more about AFP's achievements from other speakers this morning, I just want to take a few minutes here to talk about the impact right here at the Bloomberg School. Advanced Family Planning and the Gates Institute leadership helped to establish the school's new Learner Center for Public Health Advocacy, which aims to train the next generation of public health leaders in advocacy and decision-maker engagement. They were also central to developing the school's advocacy certificate for master's students. Elements of AFP's advocacy approach, referred to as SMART advocacy, have been integrated into classroom instructions for the past decade. And earlier this year, the school launched the first online course dedicated to SMART advocacy and made it adaptable to many, many public health issues in any geography. Through these efforts and many others, we've seen interest in and training on public health advocacy flourish at the school. Advocacy in many forms is now taught across departments and programs. And in 2018, advocacy became one of the 5 pillars of the school's new strategic plan. There's a reason why advocacy is core to our work. When it comes to the pressing public health issues facing our world, of course, good science is important. It's critical. But if it's not embraced and implemented, good science is just not enough. Advocacy is what turns research into real-world impact. When we effectively communicate with the public and decision makers, we can change the way they think about investing in public health. Looking back at all that advanced family planning has accomplished, we have many reasons to feel hopeful about what advocacy can achieve. Of course, there's much left to be done, but this impact report shows that the right partnerships can create large-scale, lasting change and help us build a healthier world. At the Bloomberg School, we believe that advocates will help shape the future of public health. And I am so proud of advanced family planning and so grateful to their partners around the world for making a profound impact on the health and well-being of individuals, families, and communities. I do hope you'll enjoy the rest of today's launch event, explore the new report, and continue to believe in the power of advocacy to protect health and save lives, millions at a time. Back to you, Tanusree.
Thank you, Dean McKenzie, for highlighting the hope fostered by the power of advocacy. Our next speaker is the Honorable Constantine Kiansu. He is a Member of Parliament in Tanzania and Secretary General of the Tanzania Parliamentary Association on Population and Development. He will discuss the importance of civil society and government partnerships. You have the floor, Honorable Kanyasu.
As part of my parliamentary representing the Tanzania Parliamentary Association on Population and Development based in Dodoma, I have always strongly advocated for women's health, especially the right to access and use family planning services. Our association was revived in 2013, and ever since we have strived to partner with a number of civil society organizations, as well as initiatives that include Advanced Family Planning Project. This partnership thrived because the timing was right. First, the global national environment was conducive to reproductive health and family planning issues. Hence, a number of actors were able to access resources to undertake population-related issues. Secondly, momentum was building up as civil society organizations and the government were fully engaged in the implementation of the National Family Planning Costed Implementation Plan, poverty reduction strategies, and the Millennium Development Goals. Tanzania had begun implementing its FP 2020 country commitment, while efforts were ongoing to ensure family planning assumed an integral position in the country's reproductive maternal newborn child and adolescent health strategies. And above all, it was a time when advanced family planning took center stage in empowering parliamentarians with data, information, and a platform for dialogue on population and related issues, including family planning, demographic dividend. The effort is characterized advocacy for issues that our association focuses towards sustaining political and policy commitment. We have seen great success over the years. For instance, the family planning budget increased from 1 billion in 2013-2014 to 14 billion Tanzania shillings 2017-2018. Our advocacy efforts will continue because we know this is not inadequate. Our members work closely with the local government in making sure that resources are channeled to improve family planning and reproductive health services. Our parliamentary association has remained steadfast in making sure that family planning services are uninterrupted during COVID-19 pandemic. Also, policies that we advocated for, such as special provision on fast-tracking the procurement of life-saving health commodities, including contraceptives, in 2016 are being implemented. So, what made this partnership successful? The partnership between our association and the civil society organization was mutually reinforcing. On the one hand, we, the parliamentary, amplified the advocacy and asked the civil society that called for more investment in reproductive health and family planning, equitable access to services, and the family planning acceptance and use. And on the other hand, parliamentary champions benefited from capacity building initiatives by civil society that enhanced our advocacy skills, connection with the regional and the global parliamentary networks. We are now more equipped in using data and evidence toward fulfilling our oversight role on population-related outcomes. Going forward, our association will continue to collaborate with actors in population and development, specifically those focusing on family planning as an integral intervention in the country's socio-economic efforts. Thank you so much.
Thank you, Honorable Kanyasu, for highlighting how advocates leverage data and information to empower government officials to act. Our last speaker is Dr. Mariam Njai, the Chief of the Division of Family Planning in the Department of Maternal and Child Health of the Senegalese Ministry of Health, who will discuss the power of subnational advocacy to advance local change. Dr. Njai.
Je suis le docteur Mariam Ndiaye.
I'm Dr. Mariam Ndiaye, head of the Family Planning Division as a Directorate of Mother and Child Health, Ministry of Health and Social Action of Senegal. I am honored to join you today to talk about the substantial impact advocacy can have at the local level. Indeed, in this process, the Senegalese government has been a proud champion for family planning as a member of the Ouagadougou Partnership, are the commitment maker to family planning 2020. In 2012, Senegal committed, like most of the country in other country, committed to doubling the overall reproductive health budget from 2.5 to 5%, and increasing the budget for contraceptives by 200%. What we can find, this commitment faced a test in 2014 when the government passed a reform that transferred more budgeting power, including health budgeting, to locally elected mayors. We noticed that in Senegal, we have about 500 territory communities, that is 500 mayors. The issue, in any event, we can do so that these mayors give the priorities to the family planning in their respective communities. We also need to greet partners like Advanced Family Planning. They are privileged partners in Senegal. They allowed us to show the path. We also need to hail that AFP won one of the first global initiative of family planning advocacy to focus their efforts at the local level to support the advocacy at the local level. We can also note that the first two funding commitments made by the mayors in 2014 in the two administrative areas, it led to 6 additional commitments by the mayors in 2015, and gradually we went up to 48% in 2016 and 2017. We were able to have 64 mayors who gave us financial resources for family planning that made that 64 millions of families. We were able to have 64 millions of USD allocated. That's funding that stimulated considerably the allocation by the central government, that supported the organization of some activities like free consultations in family planning, in some service facilities. We were able also to have a contribution to purchase contraceptive products, also some sessions of family planning with committee players and advisors. We can also note that those efforts for the advanced family planning lay the foundation for mayors and the local leaders to be strong champions for family planning. And it helped strengthen the civil society organizations and networks that we in government partner with and rely on. We must say that we can also note that in Senegal, collaboration is really top when we compare with other countries. What we also can take away, the smart advocacy locally triumphed in Senegal. Advocacy that engages mayors is now integrated in lots of projects. To mention one, the NIMA project that is USAID funded, among others, that new great success. Today, Senegal's vision is for all women to have equal access to high quality and affordable maternal, newborn, and child health services, including family planning, all the services of family planning. Such is a commitment made by Senegal within the movement 2030. We cannot then since the London summit in 2012, the modern contraceptive rate for married women increased from 16% in 2012 to 26% in 2019, which is a notable outcome. So we must also say, with this progress, all local champions are stronger than ever. There is still much to do, but the Ministry of Health and the local groups of civil society are committed to ensuring that every Senegalese man, woman, and young person can reach their full potential through access to family planning, which today is recognized as an efficient strategy for saving lives and reducing maternal, neonatal, infant, and adolescent mortality in the country. And it is a flagship objective of the country's national health and social development. Thank you.
Dr. Njai, thank you for sharing how civil society organizations and government entities in Senegal were strengthened by advocacy. Again, a round of virtual applause for all our panelists for your time and thoughts. And now we are excited to unveil highlights from the report.
We embarked on this report because we wanted to make space to recognize the power of advocates. Often, advocates are quite happy to work behind the scenes, to center our focus either on those in power or those who need services and support. But every now and then, we need to pause and celebrate our progress. And with the Advanced Family Planning Initiative entering its final year, we wanted to create a space to acknowledge what 13 years of family planning advocacy can achieve. At the beginning of this effort, we asked members of our community, what is the power of advocacy to you? We heard that the power of advocacy is evidence, consistency, perseverance, and passion, among others. Throughout this presentation and after, in the chat box and on social media, we invite you to share with us what you think the power of advocacy is, using the hashtag Power of Advocacy.
To truly know how far we have come, we need to understand where it is we started. When Advocacy Advanced Family Planning, also called AFP, launched in 2009, commitments to family planning had lost political traction in the donor community. The issue was absent in global health and development frameworks, such as the Millennium Development Goals. Most countries had supportive family planning policies, but lacked implementation. And family planning funding was largely not a priority in country budgets, despite high rates of unintended pregnancy and maternal deaths.
Frustrated by the slow pace of change, a small group of passionate and committed advocates came together to set a bold agenda through the AFP initiative. AFP's first partners recognized that there were local and national champions who, when given the opportunity, tools, and resources, were poised to transform their policy and funding environments for family planning. These efforts coalesced under a broad goal to galvanize financial investment and political commitment to voluntary, high-quality information, services, and supplies, and objectives to mobilize more funding for family planning, strengthen family planning policies and policy implementation, grow the number of organizations using smart advocacy, and fostering sustainability. Along the way, advanced family planning grew from that small group of organizations in 3 focus countries in 2009 to a 4,000 person strong advocacy initiative that has partnered with nearly 50 organizations in 31 countries across Africa, Asia, and Latin America.
To build a more robust, integrated approach to advocacy, our partners set out to make a strong case for family planning across sectors. With the foundation of local leadership and collaboration, AFP provided a platform to incubate ideas, pilot approaches, find solutions, and share knowledge and expertise. As we evolved, strategic initiatives were added to advance adolescent and youth access to contraceptives, expand self-care, and harness the power of journalists through media advocacy. AFP also initiated the Opportunity Fund, a small grants program that supported locally identified advocacy needs.
3 factors underpinned AFP's approach. First, through our convening power and strategic inclusion of governments, civil society, and the private sector, AFP sought to create long-term changes in policies and funding across sectors. Second, rigorous ongoing monitoring of progress and results helped make the case that advocacy is a strategic priority alongside service delivery, research, and other programs. We also strategically focused on where decisions are made, which allowed us to deliver results across a variety of country contexts. from those with a history of strong family planning programs to ones where support is still nascent.
And of course, the heart of AFP's approach in the smart advocacy framework. Adapted from well-established management tools, smart advocacy focuses on achieving discrete, vital policy or funding decisions in the near term, leading to a broader goal. Disciplined, purposeful, and results-driven, smart advocacy centers on decision makers. At the same time, it is flexible, allowing champions to change course as situations change. In short, it was and continues to be game changer in family planning advocacy. The tool was updated just last year so that users can easily apply it to any advocacy issue.
And now for our impact. AFP drove a number of sustainable investments and improvements to help individuals and couples effectively plan for and prevent pregnancy. We significantly increased financial investments in family planning from governments and the private sector. Between 2012 and 2021, AFP mobilized nearly 170 million US dollars in domestic funds for family planning. The 2021 funding levels in AFP countries reaching nearly 10 times that of 2012. We also knew that national government allocations would be a vital resource, but along the way, we have seen how subnational governments have been increasingly important, as you can see in orange. Today, 329 government units in AFP countries are allocating funding for family planning, compared to 11 at the start of AFP, nearly 30 times what it was just 8 years ago. These investments have proven durable even through the COVID-19 pandemic, demonstrating the value of the infrastructure AFP established.
Our partners achieved nearly 3,000 family planning policy and funding gains across countries and regions at every level of government. The Power of Advocacy report features a new map highlighting a new number of wins across several thematic areas, such as improving information and counseling for family planning, increasing task sharing and training opportunities, expanding access to contraceptive services and supplies, and partnering with youth to lead their own advocacy efforts.
From the outset, AFP partners knew that the need for family planning funding and policy change would be everlasting, but our initiative would eventually end. Thus, sustainability was incorporated in every advocacy effort, focusing on how policy and funding gains could last. Preliminary data show that once AFP engaged governments allocate funds for family planning, they are likely to continue to do so after AFP-funded advocacy efforts end. Of 76 geographies that phased out of AFP funding, 3/4 continue to do so for 1 year following phase-out. Half continue to make allocations after 2 years. In 2020-2021, 66% made allocations totaling $970,000 US dollars, and 40% of those geographies increased their allocations despite the pandemic.
As AFP's partners and collaborators saw this impact and recognized the power of smart advocacy, driving its adaptation, spread, and influence. As a result, 303 organizations across 42 countries are creating change with smart advocacy today. With a large footprint, more than 18,000 staff in 128 countries, these organizations are well positioned to multiply the smart advocacy approach and ignite further impact.
In just over a decade, the AFP initiative built a powerful platform of expert advocates across the globe. This success clearly demonstrates that a sustained, multi-year global advocacy initiative for family planning works. As we remain committed to sharing what we have learned, 3 core lessons have emerged. First, trust country advocates to lead. Donors have long expressed the desire to shift ownership of programs to the Global South, but the transition has been slow. AFP's success demonstrates that local advocates are well placed to identify advocacy opportunities, build strategic plans, and create lasting change. Supporting local leadership will fully realize the power of advocacy in family planning, reproductive health and rights, and other development priorities.
Second, advocacy outcomes grow with long-term investment. AFP benefited from the opportunity to mature over a long period. However, the initiative will end during an increasingly uncertain time for family planning. With family planning often deprioritized or forgotten, protecting gains and preventing regression require ongoing investment. Advocates are ready and able to overcome challenges with the right support.
And finally, collaboration creates change. Dedicated advocates with a desire for change underlie all our accomplishments. AFP was instrumental in convening the right people at the right time to coalesce efforts and accelerate progress. Change is possible and occurs faster when advocates and decision makers work together.
However, even with the accomplishments of AFP and other advocacy efforts, family planning remains controversial and out of reach for many. More and better investment in a holistic approach to family planning remains urgent, not just during the COVID-19 pandemic, but also once the immediate threat passes. Persistent advocacy and a connected community are essential to ensure that the funding, policies, and infrastructure are in place to enable everyone to realize their fertility intentions and fulfill their reproductive health needs and rights.
I'll have the opportunity to hear from 3 advanced family planning partners to hear stories of how advocacy investment has transformed their policy and funding environments. The first is Beatrice Kwache. Beatrice is a senior advocacy officer for Japaigo, AFP's lead coordinating partner in Kenya. Beatrice will share with us how one small, youth-focused advocacy effort that began in 4 counties has now had nationwide impact. On to you, Beatrice.
Thank you very much. As mentioned earlier, I'm going to give a brief overview on the power of advocacy, especially on establishment and scale up of the multi-sectoral teenage pregnancy task forces in Kenya. Just to give like an overview of why we are talking about task forces and especially at the subnational level. AFP, as we are working within our various subnational levels, we started in about 4 subnationals. And out of these 4 subnationals that we are working in, we realized that all of them were way below the national average of 18% on teenage pregnancy. Some of them were ranging between 30 to 35. And this is what actually informed us to look into strategies to address teenage pregnancy. So why the change? Why did we want to do this? Because we wanted to have a more coordinated way of addressing issues to do with teenage pregnancy. So at the subnational level, we were able to establish or form family planning champions who are people of like-minded that came together to address and come up with strategies, and they were ranging from local champions and also some of the gatekeepers. And the second thing we did is the multi-sectoral task force that we formed at the subnational level. And the task force was really comprising of different players at the subnational level. Just to give a few examples, we had the Minister of Health, Minister of Education, and also Youth and Affairs Department. So once we had a multi-sectoral task force, we were able to develop a joint action plan that really each and every department that had issues came up and they were able to put them down and come up with the strategies to address, working collaboratively and leveraging on each other's strengths. Then once we did that, we had a circular that went out that already now there's a coordinated system way of collecting data. So the circular was informing all the levels to come out and record data on teenage pregnancy and also be able to come up with the workable strategies. Next, please. Once we have this at the subnational level, it actually informed the scale up on the fight, the national scale up on the fight against teenage pregnancy. And one would ask, what are those things that really inform the national scale up? I want to give an example in one of the counties, Kwale County, that we work in and was among the initial counties, had an 86% increase in family planning visits for 10 to 19-year-olds that were really seeking contraceptive services in the county. And the second example that I'm giving is the multi-sectoral approach in Migori County, which was also one of our initial counties that really contributed to 16% reduction in adolescent pregnancy. And away from 37%, this was in 2016, up to 20.8% in 2020. And this was according to the midterm survey. So these are some of the examples that really were able to inform the national level on the scale up of the fight against teenage pregnancy. And they're also able to come up with a task force on the same. Next, please. So far, what are the impacts that we've seen, both at the subnational and the national level? First, the formation of the National Multi-Sector Task Force on Teenage Pregnancy is a key thing because this task force is bringing all the players together and they are able to work in a collaborative mechanism. And the second one is the development of the multi-sector action plan on reduction of teenage pregnancy at both levels. The action plan is talking about various issues to be addressed. For example, data collection and reporting is one key thing that really is being addressed in the action plans. And then the third one is that all the 47 county commissioners and regional commissioners are now championed to fight to fight against teenage pregnancy and be able to follow up on the issues that are affecting their various counties. These 47 counties is like a scale up, as I've mentioned, from the 4 counties that AFP was working in, and now it's in all the 47 counties within the country. And then the directive on the scale up of the multi-sector task force across all the 47 counties. This directive is going out to inform all the 47 counties that they really have to come up with the issues. I mean, they really have to address issues on teenage pregnancy and develop implementable action points moving forward. And the directive also will be talking about a common reporting platform on teenage pregnancy. A common reporting platform, meaning there's a data tool that is going to be used to report teenage pregnancy across all levels of the government. And just to mention, maybe one would ask, so what is the power of advocacy? What has it helped to do? As AFP, I would say that really advocacy has helped us to unblock policy barriers and be able to work collaboratively across all the sectors within the country. Thank you very much. And in case there are questions, we'll be able to do this in the question and answer session.
Thank you, Beatrice. It's exciting to see how multi-sectoral youth action plans are now a best practice across all of Kenya. Our second impact story comes from Ilya Kure. Ilya is a family planning champion and journalist from Kaduna State in Nigeria, and a senior member of its state advocacy working group called FANI. Since 2012, AFP has mobilized $8.4 million across 10 Nigerian states, including 1.5 million from Kaduna State alone. Ilya will share what that advocacy journey looks like. Ilya?
Kaduna is located in northern Nigeria and is the third most populous state and has a population of 10 million people. 2 million out of them are women of reproductive age. Prior to 2017, family planning had some challenges in the state. The first being that the state government itself has not prioritized family planning as a program. The second is the low uptake of family planning by women due to user fees that are being charged. Federal government generally supply family planning commodities which are, distributed to all facilities, public facilities. But then women are charged fees towards consumables in order to access service. We conducted activities, majorly advocacies. Sorry. We conducted advocacies through the support of NURI in order to advocate for creation of budget line. The first budget line was introduced in 2017, and the sum of 100 million naira was allocated in the line. Of course, there was no releases in that year. Pathfinder International came to Kaduna and partnered Fanny. They trained our members on the use of smart advocacy tool, which we employed in identifying our key stakeholders and then relevant policy makers. We conducted advocacies that led to releases of the funds as well as procurement in March 2018. When the consumables were procured, there was that challenge of distribution. So Fanny conducted advocacies to Save 1 Million Lives program. The sum of 7 million naira was released, which was used in the distribution to last mile. Same year, we conducted advocacies to the state government in order to create a second budget line in the state. From the experience we've had, the first budget line only addressed procurement. So we needed another line that will address other thematic areas of family planning. Since then, we've had consistencies in, allocation to family planning in Kaduna State. In 2019, the second budget line reflected the budget, and the sum of 26 million naira was allocated in the budget line. We met Save 1 Million Lives again, and then additional funding was secured from them to train service providers. After that, additional service delivery points were added. It was scaled from 534 to 711. Currently, there are 714 in the state. We have employed the use of fact sheets, scorecard to engage government and to hold them accountable to the commitment they have made and their responsibilities. So far, we have seen increase in activities around family planning in the state. There are ongoing meetings. A lot of other trainings were being, conducted, and family planning has taken priority as far as the health programs of the state is concerned. We've seen consistency in increasing funding in the family planning. Last year, the state government allocated 250 million naira to cover for a funding gap that existed in the state. Of course, the money was not released last year, but we have engaged the government this year, and the process of revalidation has commenced. We are optimistic that there's going to be procurement of up to 250 million, additional 250 million naira, aside the 100 million naira that is already in the budget, to procure consumables and commodities this time around, so that more women will be reached with products, with consumables and commodities. Due to the role played by Fanny in the state, Fanny has been added, into the technical working group in the state, as well as, engaged in the development of the budget, each year's budget in the state. So far, so good. We have seen the intervention by AFP, to address quite a lot of issues in the state, by ensuring that a budget line has been created to provide consumables, which addresses, the money spent by families in order to access services. Aside that, trainings have been conducted, and then the service delivery points have been increased in the state. We believe this has gone a long way in reducing the challenges faced by women and families in terms of having access to family planning services in Kaduna State. Thank you.
Thank you, Ilya. Finally, we will hear from Rafia Roof. Rafia is the project director for the Forum for Safe Motherhood, which serves as a Pakistan member of the White Ribbon Alliance. The Forum for Safe Motherhood received an Opportunity Fund grant and combined smart advocacy with their own communication campaign to great success. The floor is yours, Rafia.
Thank you, Sarah, and hello, everyone. Today, I will be sharing with you a budget advocacy story from Pakistan. Now, as you all know, that 2019 was the year of the COVID. Pakistan, like several other middle-income countries, has a fragile health system, which was further compromised by the added burden caused by the pandemic. Now, at that time, it was becoming increasingly apparent that for the government, emergency resource management was a need of the time. And this was resulting in shifting of resources from, so to speak, non-essential services towards addressing the pandemic. Now, the province that fell victim to this change in strategy was the province of Khyber Pakhtunkhwa, which we refer to as KP because Khyber Pakhtunkhwa can be quite a mouthful. Now, when the provincial government of KP announced the budget for the financial year 2020-2021, there was around 10% decrease in the resources allocated for family planning. Now, we knew how great a need family planning is in the province. And we knew this because back in 2018-19, we were part of a global level campaign called What Women Want, which reached out to 1.2 million women in 114 countries. And of this, 250,000 women were from Pakistan alone. Now, from all these women, only one question was asked. What is your top request for your maternal and reproductive health care? Now, for the 35,000 women in KP, family planning stood out as one of the top 10 demands, with their fan-related asks revolving around availability of commodities, accessibility to FP services, desire for information about FP methods, and improved quality of FP care. Now, having this insight into the needs of end users compelled us to make a case for budget advocacy with the relevant decision makers in the province. Now, in Pakistan, the financial year is from July to June, and the budget is announced towards mid to end of June. This basically means that we had a window of opportunity from January to end May to be a part of and influence the budgetary planning process. So we planned a multi-pronged approach, which comprised of conducting a landscaping analysis of FP situation in the province and using the findings along with that of the What Women Want campaign to advocate with the decision makers about the importance of family planning and the need for resources. Now, for the purpose, we held a series of meetings and consultative sessions with concerned government officials. We got on board the right partners to strengthen our voice. We used media very strategically to create the necessary pressure, and we enlisted the engagement of women. Now, of all these, it was the women engagement mechanism that really served as a game changer. In the province of KP, we used one of our tried and tested approach of listening sessions. Now, these sessions are so designed so as to facilitate direct interaction between women as end users of family planning with decision makers. Here, the women directly share their key asks regarding family planning, and they also propose potential solutions. Considering that the government does not have any similar mechanism in place, the voices they heard here played a critical role in making a case for budgetary increase. Now, imagine being a decision maker and sitting in front of women and then listening to them directly about wanting family planning services at their doorstep, or wanting a family planning awareness program, or wanting a lady doctor in there, or asking for contraceptive methods which are accessible and effective. Now, well, apparently these voices are quite powerful, and these combined with the strategy really made the difference. So when the budget for the financial year 2021 and 2022 was announced, there was a 56.8% increase in overall budget for family planning program. This, by all means, is huge, and honestly speaking, it was way beyond our expectations. Now, what does this increase actually mean? What will it actually materialize to? Well, this means that now there are going to be more funds available for the establishment of 200 new family welfare centers in the province. There are going to be 10 adolescent and sexual reproductive health centers. There are going to be mobile service units in certain marginalized areas in response to women's need of wanting services at their doorstep. And of course, consolidation, strengthening of existing service delivery units. Now, you can't imagine how good knowing about all these development feels. But then this is what advocacy is all about. It is long, hard, and often extremely frustrating struggle. But then at the same time, it is the only tool we have, for shaping the decisions that are going to impact our lives. And as they say, the harder the battle, the sweeter the victory. So while increasing resources was a big step, and we are really happy about that, we also know that our work is only half done. We are now focusing on maximizing resource utilization for family planning in the province. And while it is really early in the game, our advocacy work is bearing good results. But then that is a story for another time. You should invite me another 3 to 4 months' time, and then I will tell you all about it. So for now, thank you for listening to me and for giving me this opportunity to talk about our advocacy win. And I think now it's over to Sarah. So over to you, Sarah.
Thank you so much, Rafia, and to all of our impact storytellers. You can see more quotes and testimonials from our partners and collaborators in the Power of Advocacy report. Back to you, Tonasri.
We now want to take a moment to acknowledge those who contributed to the success of this initiative. In the report, our list of all partners, sub-guarantees, and Opportunity Fund awardees takes an entire 3 pages, so it is impossible to name them all individually here. We are deeply grateful for and humbled by all your contributions. We are also grateful to our donors, the Bill and Melinda Gates Foundation, the William and Flora Hewlett Foundation, and the David and Lucille Packard Foundation, as well as to anonymous donors.
We now invite you to download and read the report and share our social media messages with your networks. For those of you attending the International Conference on Family Planning in November, we will also host a final closeout celebration event in person. We also want you to know that the conversation doesn't end here. AFP will host a series of 1-hour discussions around the learnings from the report in an upcoming knowledge and learning series. The first will be held on June 28th.
Do you have any questions for our featured storytellers or about the impact report?
All right, great. So please start to put your questions in the Q&A chat box. We already had one come through during Beatrice's presentation, and it was, how do you determine or identify a person or individual as a champion? Beatrice, why don't you kick us off on that one?
Yeah, thank you very much. And the way we identify the champions, especially at our level for family planning, there are people who've over time shown interest in dealing with the adolescent and young issues of young people. And they could range from people talk about influential people in the community, celebrities, and so forth. And this could be people maybe working with the government or even individuals at different levels. And just to add on that, when I talk about champions or the people we've worked with different categories of people like the national government, the National Council for Population and Development, and even other partners on the ground. So the champions are drawn from this category of people. Thank you very much.
Great, thank you, Beatrice. And just to add on to that, our recently refreshed Smart Advocacy tool has some more supportive steps you can take to identify your champions. Sometimes we call them allies, sometimes we call them messengers. They can be involved in different ways in your advocacy initiative. So there's a lot more information on how to build those working groups, how to build those relationships in our Smart Advocacy tool. I think we might have time for one more. I see it in French, but I'm not sure what the English translation is. Maybe our interpreter can help with that.
Yes, the second question. Okay, Mr. Yoropo Dembele, he would like to know how exactly does the mechanism of fiscal allocations, budget allocations, how can it help support the cause of women and girls in this domains? How is fiscal allocation important?
All right, that's a great question. Thank you, Yoropo. I might ask, we had two presentations on financial allocation. So I might ask Rafia to jump in first on her experience in Pakistan. And then if we have time, Ilya can add. Rafia, are you able to unmute?
Yes, I am.
Great.
What's the question?
The question was why is family planning allocation so important in getting women and girls contraception?
Oh, well, I believe that I kind of like answered that in my presentation, but I will go over it again. Basically, when we were involved in the What Women Want campaign, and we asked women their key asks regarding their reproductive health, in the province of Khyber Pakhtunkhwa in particular, family planning came forward as the top 10 needs. And then when we explored that further, we realized that what is really lacking is the availability of commodities and the desire for information. And for women, it's very difficult for them to access these services. Khyber Pakhtunkhwa in particular has very hard geographical terrain, so that makes it difficult as well. Now, looking at all that, then we saw the resources, and we found that for some reason, for government in times of emergency like the COVID, this falls in the category of non-essential. That means this is the one thing which ends up being compromised. So, and that is because all these needs, all these asks of these women are not really figuring on the decision makers' radar. So that is why it was important to come forward and inform them how great a need this is on ground. And that really helped in mobilizing the resources. So basically, it was a matter of taking evidence, taking voices of the women, of the end users from the field to the decision makers, and helping them make a right decision about resource allocation. So I hope I've answered the question.
Thank you, Rafia. And Ilya, if you have anything to add, maybe put it in the chat since we need to wrap up. We're right on time. So thank you, everyone, for joining us this morning. Tonisri, why don't you take us out and let us know where people can find the report?
Yeah, thank you, Sarah. Please download your copy of The Power of Advocacy at advancedfamilyplanning.org/Power of Advocacy. Thank you, and have a wonderful rest of your day. Goodbye.
Goodbye. Thank you so much. And to all our speakers.